Dr. Garima welcome you all in my YouTube channel. Friends, today I am going to explain you about the topic tumor, that is neoplasm. It is an abnormal and excessive growth of tissue and that is called as tumor. This video is also available in Hindi language and you can see this in the description link of the same video here online. I am going to explain you what is tumor, how it develops, the symptoms of the tumor, that how can you assess that this is a tumor, and its homeopathic approach in this video. So kindly be with me till the last in this video. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the next videos too. So let's begin with this topic, tumor or neoplasm or benign growth. Now, what is this tumor? So it is an uncoordinated, uncontrolled growth of the tissue and it is abnormal regarding that surrounding ones. So uncoordinated and uncontrolled growth of any tissue leads to this tumor. It is of three types: benign, potentially malignant, and the last one is malignant. Benign is non-cancerous one, while malignant is the cancerous growth. Now, what are these benign ones? So, for example, we see uterine fibroids or localized any growth or tumor, melanocytic or skin moles. These are benign one, or osteophytes. So these are benign, means they are not having any tendency to turn into cancer. That's why they are benign. They are circumscribed and they are localized at a single place. They will not transform into cancers. They will not spread into other organs. That's why they are benign one. Next one is potentially malignant. So they are the cancers exactly, but in situ, means they are localized at one place. They will not destroy other organs or they will not invade into other organs. And they are localized especially maximum times. But they may also transform into cancer and can affect the surrounding areas or can affect the whole body too. But it is a rare one. So they are especially localized and stay at a single place. But they are cancerous one. And the last variety is malignant one. So they are the cancerous one and they are the exact cancers. Because they invades other organ, they infiltrate into it and they destroy the surrounding tissues as well as distant organs too. It may lead to multiple organ failure too, and if they remain untreated, unchecked, then it will be fatal. So these are the exact cancers. So malignant variety is the cancerous one. There are secondary neoplastic growths which follow after the treatment of primary tumor, like chemotherapy or radiotherapy. So after that primary tumor, it gets infiltrate into other organs and some secondary tumors or neoplasm growth occur because of the treatment of that particular primary tumor. So the cells of that primary tumor infiltrates into somewhere else in the body and form another growth. So these are the secondary neoplasms. Now friends, what is the difference between nodule and tumor? Everyone may suffer from these nodules in day-to-day life and they may get confused with this tumor. But there is a difference. If it is less than 20 mm size, then it is a nodule. And if it increases more than it, then it is a tumor. And we will discuss many more tumors in the next lectures. So just connected with us. We will discuss fibroadenoma, fibroid, etc. and many more tumors in our next lecture series. Now let's talk about the causes of this tumor. So there may be genetic history, familial history, hormonal history, or any previous injury history. For example, any previous injury to the brain may lead to brain tumor or brain cancer. Any kind of outflow obstruction or narrowing of passages may lead to tumor before the area of that obstruction. Then genetic mutation, that is DNA damage or any kind of mutation in the genes may lead to this malignancy or cancer. Now what are the risk factors for this? So some exogenous agent may increase the risk of this tumor like tobacco, solar radiations, UV light, that is ultraviolet light, and high fat diet or high rich food may lead to this or may increase the risk of this tumor or cancer or malignancy. Now what is the treatment part according to allopathy? So excision of that tumor is the only way of treating any tumor. Now let's discuss its homeopathic approach. So what is the cause of this tumor according to homeopathy? So cause of this tumor differs area by area or location by location. So we will discuss it in their chapters. That is, if there is fibroadenoma, so we will see the cause of that fibroadenoma in the lecture of that fibroadenoma. And if the tumor is fibroid, that is in uterus, so we will discuss in that video. Now let's discuss some of the homeopathic medicines that can be helpful in curing this tumor. So the first medicine is entim crude. It covers maximum of tumors like ganglia, atheroma, that is collection or accumulation of material inside the inner layer of the blood vessel, or any kind of hard tumor, papilloma, benign or malignant one. Now the variety that covers this entim crude is hard tumor, horny tumor, and there are colored scabs left after that, and it aggravates after cold bathing. Tumors are always conical in shape in case of entim crude, and it cures big tumors too. Now let's talk about the mental symptoms of this entim crude. Is patient is too much sentimental and more concerned about his face. There is suicidal thoughts which drive him despair, drive him out of bed. Talks in rhymes and verses, cannot bear to be touched or looked at. So if these symptoms correspond, entim crude will be helpful in curing such tumors. Next medicine is aurum iode. It covers tumors of muscles especially, that is myoma, atheroma. There is induration of uterus or ovarian cysts, or there is induration within the testicles. So it covers all these tumors. Now let's discuss about the mental symptoms of this medicine aurum iode. These patients have a strong desire for open air, very strong person, sensitive to noise, fast person, and very strong constitution, duty bounded. And they are very much industrious, responsible person, and they are positive constitution, restless, and they have aversion to company. So if these symptoms correspond, aurum iode will be helpful in curing such cases of tumor. And the last medicine is calcarea. So it mainly covers slow growing tumors like tumors of muscles, myoma, atheroma, tumor of nerves, that is neuroma, ganglia, even cystic growth, which are separating in nature. It also cures fibroids, keloids, lipoma. Tumors are fleshy in it and glands are swollen in it. So it also covers glandular swelling. Now let's discuss about the calcarea constitution and its mental generals. So it is a fatty, flabby constitution. They are slow in nature, timid personalities, horrible things affect them profoundly. They are very fearful persons. They have fear of misfortune, fear of death, clinging is seen there, and clinging is with some person or with religion, desire to be magnetized. Clinging can be seen along with money or God. So if these symptoms correspond, Calcarea will be helpful in curing such tumors. That's all for today. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. This topic is also available in Hindi language and it has been given in the description link and you can see there. It's my humble request to you all, kindly don't take any medicine without consulting doctor. Otherwise, it will not be too much helpful. And I would like to say that kindly connect with this series and you can see the results in the cases of fibroadenoma, fibroid and etc. tumors. So you will be able to understand this also. Stay connected to stay healthy. Thank you.